Hi, I'm Jasmine Castillo, and sometimes I sit in my room, I sit on this bed right here, and I cry. I cry about boys, I cry about my hair, and I cry about schoolwork, specifically this assignment. But after researching and finding out about this whole disease, I realized there's nothing to cry about. Learning about genetic disorders, I realized that there's so much to be grateful for. I see how it can affect someone's everyday life. Here I am, perfectly healthy, but still crying in the club. PSA, public service announcement. I'm here today to inform you guys and shed light on a rare genetic disorder called Chediak-Higashi syndrome. This is a rare form of albinism. Albinism can be identified at birth through their pale white features. CHS can be identified through those physical signs as well. The symptoms of CHS impact their everyday life. These symptoms include a weak immune system, frequent pneumonia, skin and gum infections, bruising, weakness in the hands, the knees, seizures, even in some cases. Yeah, it's crazy. You're probably wondering, what causes CHS syndrome? Well, it is a mutation in the LIST gene. The LIST gene. And the LIST gene, just for some background, manages the size and movements of lysosomes. The mutation causes a formation of abnormally large lysosomes that don't function correctly, creating immune system issues, bleeding abnormalities, and issues with melanosomes. So, most people with this condition need proper eye care. A lot of vision care, everyday visits to the doctor, and glasses and contact lenses are a must. They need to take antibiotics and medicine because they have a weak immune system, and they also may need blood transfusions in cases of excessive bleeding, and in life-threatening cases, a bone marrow transplant. Fun fact, albinism is a condition. Although it causes visual disability, albino people can live a basically normal lifespan. However, in CHS, it is a disease because it goes beyond pigmentation issues and it affects multiple organs. CHS can cause life-threatening complications and is therefore a disease. CHS syndrome is inherited in an autosomal recessive pattern, meaning both parents must pass on the mutated gene. This means CHS cannot be prevented because it is a genetic condition. But you know what can be prevented? Your outlook on life. Which brings me back to my first point. Learning about CHS has shifted my view. I realized that there is so much to be thankful for. People living with CHS albinism suffer from not only health challenges, but social issues as well. People have told their stories about being bullied, being called names, and being social outcasts. Besides that, CHS is life-threatening without proper treatment because they face such harsh immune complications. So the typical lifestyle of someone living with this: frequent doctor visits, regular transfusions, and even with all these issues, they still have things to be grateful and happy about. So next time I feel depressed or want to complain, I remember all the things I have to be grateful for. Excuse me, I'm thirsty. So what do you think? Is this glass half full